Yes. Yeah. So these chairs are nice and comfy and cozy. Yes.
So tell me a little bit about NeuroStar TMS therapy.
Yeah, so NeuroStar TMS, like unlike medications that travel through the entire body through the bloodstream, NeuroStar focuses on a bit of a different mechanism. So, like I like to explain to patients, is a lot of the body runs on electricity or electrical pulses. So that's how our heart beats, that's how our muscles twitch, and that's how our brain cells speak to each other through these little electrical pulses. And essentially, what we use here is the coil, which is a magnet that creates a small electromagnetic field that can then communicate directly with the brain to influence change. So we treat the left side of the brain for depression to an area specifically called the dorsolateral prefrontal cortex. And what we find in patients that are depressed is that area is under functioning. So TMS is a very stimulating treatment, and it can stimulate that area to act in the way that we would want rather than in the depressed fashion.
Do you see different side effects, versus medication with NeuroStar TMS?
Yes, so there are some side effects with TMS, not that many. 98% of patients, according to the literature, do complete all of TMS, so it shows you it's comfortable enough. But that the most common side effect would be discomfort. So sometimes the coil can be a little uncomfortable, but patients tend to uh, become more comfortable throughout each session and throughout the
Yeah.
whole 36 sessions, so much so that actually sometimes patients may even fall asleep in the chair. We encourage them not
Yeah.
to, but that can happen.
It is comfortable.
Hmm.
So tell me a little bit more about how it works and what's some of the efficacy behind NeuroStar.
Yeah, so TMS has been around for quite some time. Madison spoke to earlier how many patients have been treated. It was FDA approved in 2008, 2009. And so we have lots of literature. We're just going to focus on a couple of studies here today. So specifically, the slide that you're looking at is referencing a paper that was published in 2020. And it was a retrospective analysis from multiple different sites, 103 different sites that included a bit over 5,000 patients. So a very big uh, analysis. And essentially, this was a real world analysis, which is also very nice because sometimes with clinical trials or with various studies, there's very strict inclusion or exclusion criteria that may occur, which makes sense, because we want to exclude various confounding factors that might influence our results, right? But when we're sitting in an outpatient practice with lots of very kind of ill patients, we don't have that cookie cutter person. We're dealing with people with lots of comorbid psychiatric illness, comorbid medical illness, multiple medications. And so this trial was trying to replicate that and to see, well, is TMS still effective in people who are fitting this type of mold? And what they found was the answer is yes, that up to upwards of 80% of patients actually responded, which means that they did better at the end of TMS compared to the beginning, and that up to 62% of patients went into remission. And it's really important to note that these numbers reflect people that completed all of TMS. We always encourage patients that even if you're starting to feel better halfway through, right, really important to continue the full set because that's going to get you as well as you can be.
Yeah.
So very good results.
Yeah.